This is the CT ballroom at Smilow Cancer Hospital at Yale-New Haven, where CT scans are analyzed.
Most of the ones that we look at are more rounded, and this has a little bit of a funny shape.
It is funny shape.
Thoracic surgeon Dr. Frank Detterbeck and radiologist Dr. Ann Curtis pointing out a suspicious mass that needs close monitoring.
If you meet criteria that make you pretty high risk, then I think we've got good data that it's going to be a net benefit for you. But if you don't really meet high risk, you may be much better off not getting screened.
Dr. Detterbeck is a senior author of a study that looked at all the evidence available on the benefits of a low-dose screening chest CT scan in preventing lung cancer deaths. But he says a scan is not always the answer.
You may be better off avoiding radiation, avoiding finding some little something that gets you all worried, but it's just a little something. You know, having a biopsy or something done for some little something that, you know, it would have been better if we would have not even known about it.
That's why a team approach to screening is in place here at Smilow. Amanda Reed is with the Yale Lung Screening and Nodule Program.
It's the other individuals who have other risk factors that are not identified by that study that we really need to have this one-on-one risk evaluation counseling.
While smoking is the #1 risk factor for lung cancer, Dr. Detterbeck says more needs to be done to understand the other risks so that more lives can be saved. Dr. Detterbeck is confident that in the next 3 years, screening guidelines will be more refined. Now, the now news, researchers have already linked secondhand smoke to respiratory illnesses in children. However, a new study shows kids do not outgrow the damage. Researchers followed nearly 400 people from childhood to early adulthood. Now, they found that exposure to secondhand smoke during childhood was significantly associated with later persistent respiratory symptoms such as wheezing, coughing, and chronic cold. The new data finds the number of young Americans on a crash course with heart disease has soared. That's according to a published report online in the journal Pediatrics on Monday. The study paints a grim picture, saying that 50% of overweight and obese kids have one risk factor that leads to future cardiac problems. The CDC surveyed 3,400 people between the ages of 12 to 19 for the study. Now, if you have a medical question and need an answer, just send me a tweet on Twitter, and I'll try to find a doctor who can certainly help.